Doctors in Houston are keeping their eyes on a global monkeypox outbreak. More cases are popping up in the UK and here in the U.S. For the first time, federal officials announced that they will be making testing more widely available. Fox 26's Tiffany Justice spoke to the Houston Health Department and explains what all of this means for our area.
I think that the real thing I think for people to understand is they need to be aware that it's out there. What we're seeing with this current outbreak, predominantly what we're seeing, most of the spread is actually with the skin-to-skin contact.
With around 700 known cases of monkeypox in the U.S., 20 in Texas, and 8 here in Houston, it's being considered an outbreak, and officials do expect more cases in the coming weeks. Dr. Purse with the Houston Health Department saying it does not spread easily, but it can be transmitted in 3 ways.
You can get it through droplets. In other words, if you're close to somebody, you could get some through droplet transmission. It can also be spread through fabrics. And then the final way that people get is the actual skin-to-skin contact.
Skin-to-skin contact is how Dr. Purse believes it's spreading here in Houston, with most cases skipping many of the usual symptoms and going straight to the rash.
You also have to consider, where have you been? Who have you been with? What kind of contact have you had with somebody?
Texas ranks behind California and New York with reported cases. Fox 26 spoke with a California man who's believed to be one of the first people to come forward publicly on social media that he has monkeypox.
Before I got it, I just considered it some vague thing happening in the world that didn't really concern me. It was really important for me to speak out. I wanted to try to mitigate any further, explosion of outbreaks. And I also wanted to try to reduce any stigma around it.
Usually it starts off with fever, body aches, and fatigue. The rash then follows. That's what we classically have seen. What we're seeing in this outbreak is a lot of people are going right to the rash. Now, even the rash in its early stages doesn't look like much of anything. Generally small raised bumps that then become a blister. The difference is it's a deep blister.
The virus is not classified as a sexually transmitted disease. The health department says it's considered to be a self-limiting disease, meaning many people who do get it tend to heal on their own. But if your concern is high, you're told to consult your doctor. Reporting Tiffany Justice, Fox 26 News.